Last weekend, we found out that Lakers player Brandon Ingram had been diagnosed with a blood clot in his right arm. We just got an update today that he underwent a thoracic outlet decompression and is expected to return at the start of next season. Make sure you go watch the first video I did on this topic, talking about what sort of things can cause blood clots, what the doctors were going to be looking into, and then what they might do for treatment, so that you can be a little bit more up to date with the whole story of what's happened. Today, in this video, we're going to focus on just that anatomy in the thoracic outlet so that I can help you understand why they did this surgery and what they might have done to hopefully prevent a clot from happening again. The surgery he underwent was a thoracic outlet decompression. First off, what's our thoracic outlet? Well, we've heard about this with players like Markelle Fultz recently, and the thoracic outlet is the portion of the body just beyond the neck where everything starts to come down into the arm. The next part of that surgery is it's a decompression, and so there is some sort of pressure in the thoracic outlet causing this blood clot, and so they need to do something to remove that pressure. Let's zoom in here on the anatomy in the thoracic outlet to understand what the different structures are and why we can get compression. First, let's point out the blood vessels and the nerves. So here we can see the nerves, which is part of the brachial plexus, running through the thoracic outlet and then continuing on down to the arm. We then of course have our artery, and then we have the subclavian vein in that area as well. The muscles in the thoracic outlet are really important as well, and these are the scalene muscles, in particular the anterior and the middle scalene. And as you can see in the picture, the nerve and the artery actually run right between those two scalene muscles. So that's key one to think about in terms of compression. The subclavian vein runs underneath the clavicle and goes underneath the subclavian muscle, but it sits outside of those two muscles where the artery and the nerve are. We have then the bony structure, so we have the clavicle and the first rib. And that's pretty much the main stuff in the thoracic outlet. We know that his blood clot was in the vein, so we can sort of ignore the nerve and the artery for now. Just looking at this picture, you can see all the different things that are there that could be causing compression or pressure on that vein. Whenever Brandon is shooting a basketball repeatedly and lifting the arm above the head, that space gets pressed even more. So if it's already susceptible to compression because of some anatomical deformity, by repeatedly moving your arm, you compress it even more, and that can cause irritation in that vein that can lead to a blood clot, as it did with him. There's a lot of different things the surgeons can do for a thoracic outlet decompression, and it depends entirely on what the problem is. If someone is having a neurogenic thoracic outlet syndrome, meaning the nerves are involved, sometimes they'll try to remove parts of those scalene muscles so that it's not squeezing that nerve and pinching it off. The scalene muscles don't really serve any key purpose. They're involved in some breathing and some movements of the neck, but functionally they're not that important for an athlete. So you can remove part of those muscles to try to relieve that space and give the nerve more room. Same with if that artery is being compressed. Sometimes they'll remove those muscles to give it some more space. Another anatomical deformity to keep in mind is if someone has a cervical rib. A cervical rib is whenever there's actually an extra rib that's formed that causes things to get compressed even more. If that's the case, they can remove that rib to help relieve some of that pressure as well. So we can assume in the case of Ingram that he had something done to try to relieve the pressure on this subclavian vein running through the thoracic outlet. Without actually being in there and knowing his anatomy, we can't say 100% what all they did, but the whole goal is to try to provide more space so that things don't get compressed and squeezed as much. As the news said, they expect him to be back for next season, and so let's talk about what might occur down the road. The first step after any surgery like this, whenever he recovers from the procedure, is going to be regaining that range of motion. They're probably going to do other physical therapy to try to restore more optimal mechanics of his shoulder and his shooting motion so that he doesn't subject those structures to more compression and pressure again. But this surgery isn't like a guaranteed fix. If there's something like a cervical rib that they can just remove, then you're probably going to do better in the long run, but there's always a possibility that things could become compressed and pinched off again. If the doctors see some anatomical deformity or things that are pressing on those structures and it's been serious enough to cause a blood clot, then they're going to go in and try to correct and fix it. But there is always a chance that something like this could recur down the road depending on how it heals. It's good that they think this is the cause, because if there was some other condition leading to his blood clot, that might make him more susceptible to needing long-term blood thinners if it's something that can't be reversed. This is something that can theoretically be treated and fixed, and then you can move on. So it's good. It's good that they found some specific thing that the doctors can go in and treat, something that they can go in and try to fix to prevent this from happening again. It's probably better to have this than some sort of hereditary bleeding disorder that they can't cure, they can't treat, and it's good to at least know what they think caused it rather than him being left wondering if this is going to happen again. So that's it for the video, everybody. I hope you appreciated the update to explain this idea of a thoracic outlet decompression surgery, and hopefully you learned a little bit about why they did this and what sort of things they need to be addressing in that surgery. As always, leave any comments below if you like this video and want to see more, and ask any questions as well. Until next time, thanks for watching, and we'll see y'all later. Bye.